好，咁咧，首先喺呢度歡迎咁多位嚟到我哋香港大學行為健康教研中心先。
Welcome everyone to the Center on Behavioral Health, the University of Hong Kong.
係啦，咁今日好高興啦，見到大家都嚟到參加我哋呢一個公開講座啦。咁今日呢個 program 咧就係我哋呢個何定邦先生嘅全人治療研討會講座及工作坊系列第一個我哋嘅公開講座免費嘅活動嚟嘅。
And today we're all here at the Danny D.B. Ho Lecture and Workshop Series in Holistic Therapy, and this is the first public lecture we're having called The Arts in Wellnes and Healthcare.
係啦，咁咧就我哋想介紹少少好簡單地介紹啦，因為今天呢一個公開講座咧之後陸續有嚟嘅，我哋呢2年之內都會有一啲唔同主題嘅活動嘅。
As I said, this is the first among the series of workshops and public lectures we're having, and we're now going to do a bit of introduction for you.
係啦，咁基本上呢2年嘅公開講座活動咧都係免費嘅活動啦，同埋我哋都會以廣東話為主嘅。
The upcoming lectures today and in the future will be held in Cantonese, and these are all free to the public.
嗱，咁所以希望之後各位都繼續去支持我哋呢一系列嘅活動啦。
So I hope that all of you can continue to support us in the upcoming workshops.
好，咁我哋去開始今日嘅活動嘅時候咧，咁我想邀請我哋行為健康教研中心嘅總監何天虹博士為我哋講幾句説話。
May we first invite Dr. Rainbow Ho, the Director of the Center on Behavioral Health, to say a few words to us.
咁再次歡迎大家嚟到香港大學行為健康教研中心。
Welcome everyone once again to the Center on Behavioral Health.
其實咧，我哋搬咗嚟呢一個新嘅地址咧，只不過係大概4個月，但係我哋中心咧成立咗已經接近10年㗎啦。
We've only moved here to this new building for about 4 months, but actually our center has been open for 10 years already.
咁10年嚟咧，我哋中心咧係一路貫徹住我哋嘅宗旨啦，同埋我哋嘅理念啦。
For the past 10 years, we've been trying to push forth our mission and vision
就係推廣身心靈全人健康嘅模式
to promote the body-mind-spirit model of holistic health.
咁我哋特別強調咧，就係我哋發展各種融合東方同埋西方嘅療愈嘅方法。
We're looking to develop and to integrate the Eastern and Western healing methods.
咁仲有咧，就係我哋係以嚴謹嘅學術研究啦，希望為呢啲新嘅方法咧係提供一個實證嘅基礎嘅。
And to establish a solid theoretical foundations through rigorous academic research.
嗱，咁講到全人健康或者身心健康咧，咁自從咧1946年世界衛生組織為健康定咗一個新嘅定義，就係咧話我哋健康唔單止係冇疾病，而係一個身體、情緒同埋社會各方面都達到一個良好嘅狀態。
In 1946, the WHO defined health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity.
咁全人健康呢個概念咧，喺世界各地咧已經係越嚟越受到重視。
The concept of holistic health is being given more and more attention across the world.
咁尤其是咧近10年咧，響身心醫學，尤其是係腦神經科學啦，同埋心理神經免疫學嘅發展。
In the past 10 years, in body-mind medicine, especially in brain neuroscience and psychoneuroimmunology,
更加證明咗咧我哋嘅情緒啦，我哋嘅身體啦，我哋嘅心理啦，我哋嘅人際社會關係啦，我哋嘅靈性信仰啦，都同我哋嘅健康係息息相關。
The research have shown us that our psychological well-being, social relationships, and spiritual and religious well-being are all interrelated to our health.
嗱，咁其實咧身心健康唔能夠分割呢個概念咧，喺中國傳統嘅中醫文化，喺我哋嘅理念啦，同埋我哋嘅養生概念裏邊咧，一早已經存在㗎啦。
In fact, the idea of the interconnected body and mind has long been in our Chinese medical philosophies.
只不過咧喺我哋現實生活裏邊咧，因為我哋太忙碌啦，同埋各種事情啊、各種壓力嘅發生咧，令到我哋咧係好容易咁樣忽略咗關顧自己同埋我哋身邊嘅人嘅各個方面嘅健康同埋平衡。
But we often neglect to take care of our holistic well-being and as well as those around us in the midst of our busy schedules.
咁我哋好榮幸，亦都好感恩啦，我哋得到何定邦先生家人嘅捐助。
So we're very grateful to Mr. Danny Ho and his family for their support.
咁喺嚟緊呢2年呢，我哋會通過一連串嘅研討會啦，免費嘅公開講座同埋一啲資助嘅專業嘅培訓。
In the upcoming 1 to 2 years, we will be holding a series of free public lectures and sponsored workshops.
希望咧，藉住咁樣樣咧，能夠引起廣大我哋各個階層嘅人士對全人健康嘅關注。
Hoping that we can raise the awareness of the body, mind, health, and holistic well-being of everyone in society.
嗱，咁喺呢度咧，唔能夠唔提一提咧，咁何定邦先生咧，其實係我哋香港大學嘅校友嚟㗎。
I also want to mention that Mr. Danny Ho is actually a graduate from the University of Hong Kong.
咁佢唔單止喺佢嘅事業上面有好傑出嘅成就之外，
Not only has he achieved great success in his career,
咁佢對母校嘅發展咧，更加係念念不忘嘅。
he is also very devoted to the development of his alma mater.
咁佢積極參與校董會啦、評議會啦、學長計劃啦、校友會事務等等咧，各個工作係做出咗數唔盡嘅貢獻。
He has a lot of effort and achievement in the university as a university council member, a member of the Convocation Standing Committee, and also the mentorship program.
咁尤其是咧，佢對母校嘅發展啦、學生嘅成長啦，同埋校友會嘅事務等等咧，佢係盡心盡力嘅。
He is wholeheartedly devoted to the development of the school and the students' growth, and also the Alumni Association development.
咁我哋好感謝何定邦先生家人，繼續何先生對母校嘅支持同埋關顧。
So we are very grateful to the family members of Mr. Danny Ho to continue his support for his school.
咁同時咧，亦都係佢哋對社會各界人士喺全人健康上面嘅關注。
And also their care and concern for the holistic well-being of everybody in our community.
仲有咧，就係對我哋藝術治療啦、能量治療等等我哋身心嘅各種療法嘅一個信任同埋支持。
And also their trust and support for body-mind medicine, including expressive arts therapy and energy therapies.
咁我哋希望咧，喺未來2年嘅呢一個機會咧，我哋能夠咧真係推廣切實嘅咁樣推廣全人健康嘅生活模式同埋一啲嘅方法。
So we're looking forward in these 2 years to promote the holistic well-being, the integrated mind and body well-being of everyone in society.
咁俾我哋喺忙碌嘅生活裏邊咧，能夠得到一個喜樂同埋一個平衡。
So that we may achieve happiness and balance in the midst of our busy lives.
咁喺呢度咧，我哋再次感謝何定邦先生家人，
I would once again like to thank the family members of Mr. Danny Ho
同埋多謝各位嘅支持。
and everybody's support. Thank you.
好，唔該晒 Rainbow。咁咧聽完 Rainbow 分享嘅幾句説話啦，咁可能大家嚟到我哋中心對中心同埋成個計劃嘅概念咧有多一啲嘅認識。咁不如呢個時候咧，我就想邀請我哋嘅整個活動嘅贊助人啦。咁有請何小姐去代表啦。咁Tanya 請你出嚟分享幾句説話，唔該晒。
Let us welcome Ms. Tanny Ho, one of our sponsors.
我會用中英講翻咁。I'll start with Chinese and then I'll finish with English. So, 其實我哋屋企尤其是以我爹哋呢個名義去捐助咧，其實我爹哋咧係已經過咗身，而且咧係受到情緒嘅困擾而過咗身嘅。咁所以有呢樣嘢咧，我覺得我哋屋企咧係有呢個動力咧，係想推廣，想大家人可以認識到其實。健康情緒健康係好緊要，唔係淨係身體嘅健康。咁所以希望有呢個2年嘅 program， 又好榮幸可以同即係 Rainbow 同埋 Phoenix 佢哋一齊合作，同大學呢個Center of Behavioral Health 一齊合作咧推廣呢樣。希望大家多啲人知道咧，其實唔係淨係有病即係先去睇醫生。其實平時情緒上嘅平衡啊，點樣舒緩你自己嘅壓力，其實都好緊要嘅，為自己嘅健康。咁希望多謝即係大家。咁多位嚟支持，咁希望大家陸續有嚟4月啊、5月、7月都有啲 program 咧，希望大家有機會可以一齊繼續支持呢個 program。So my name is Tanya. I'm the daughter of Danny Ho. My dad he passed away from troubled emotions before. So we just want to share that, emotional health and mental health is very important. It's not just physical health. So the message is that not just when you're sick you have to go see the doctor, but emotional health is for yourself, it's for your own balance. So thank you for all the support, and we also have a program in April, in May, and July. So sorry. So hope everybody will come and support us. Thank you.
好，唔該晒 Tanya。咁希望係啦，大家都明白我哋呢個成個活動概念裏面，即係除咗一啲活動之外，裏面有啲好深層嘅意義，我哋真係想帶俾大家嘅。
So we would want to say that besides being an activity in itself, we also want to bring out the very meaningful meanings behind our workshops.
好，咁多謝晒咁多位。咁不如咧事不宜遲啦，今天大家嚟到都好想聽一個我哋今日嘅主題啊，有關於藝術同埋身心安康之間嘅關係嘅。咁不如我而家就先邀請我哋今日嘅兩位我哋嘅講者啦 ，Vivian 同埋 Philip 嘅。
So maybe we first invite Dr. Vivian Spieser and Dr. Philip Spieser to present to us the topic today, which is on arts in wellness and healthcare. Thank you.
Welcome everyone, and thank you for having us. Thank you for coming out to this wonderful lecture and time together.
歡迎咁多位，亦都多謝大家撥冗光臨今次嘅講座。
And I want to thank the whole family for sponsoring this series of workshops. I feel very, very privileged and honored to be here at its inauguration.
我今日覺得好榮幸可以嚟到，亦都想多謝何定邦屋企人去支持呢一個活動。
And of course the Center for Behavioral Health with Rainbow Jordan and its marvelous staff for inviting us to come and share together today.
當然亦都多謝同埋健康教育中心嘅 Rainbow 啦、Jordan 啦同埋 Venus 啦，咁就邀請我哋今日嚟到呢度講座。
Can you hear me? We'll use the microphones, but can you hear me okay? Just we'll use the microphones. So this is a lecture and a time to think about and reflect about health and the arts. So as an introduction,
今日呢個講座咧就係俾大家一個反思嘅機會啦，反思下藝術同埋健康嘅關係嘅。
I'd like to invite you to just sit back for a moment and listen to a little music. Shake out your shoulders.
咁希望大家可以輕鬆咁樣坐喺度，咁就可以輕鬆你哋嘅身體啦，咁就留心一下我嘅音樂嘅演奏嘅。
Say thank you to yourself. You made the effort to come to not only listen but to be active and participate.
亦都多謝下你自己啦，你哋可以抽到時間嚟呢度參與今次嘅活動。
And when we work with the arts and health, the beginning is always the breath. That's
會同我哋參加呢啲藝術嘅講座啦或者活動嘅時候咧，第一個開始嘅地方咧就係留意自己嘅呼吸嘅。
So we invite you to just sit quietly, listen, and to breathe gently, breathe quietly.
所以我都邀請大家喺開始之前咧就安坐一下啦，調息下自己啦，同埋安靜地呼吸嘅。
take a moment to continue to listen and to continue to just monitor, watch your breath.
都俾少時間俾自己去繼續去聆聽啦，亦都係留心自己嘅呼吸。
I would like to offer a prayer as a way of beginning. It's a poem by Medicine Grizzly Bear, who was a Native American healer. And I'll read the poem through in English in its entirety, and then we'll have the poem translated into Chinese. To the four powers of creation, to the grandfather sun, to the grandmother moon, to the mother earth, and to my ancestors. I pray for my relations in nature, all those who walk, crawl, fly, and swim, seen and unseen, to the good spirits that exist in every part of creation. I ask that you bless our elders and children and families and friends and the brothers and sisters in prison. I pray for the ones who are sick on drugs and alcohol and for those homeless and forlorn. I also pray for peace among the four races of humankind. May there be good health and healing for this earth. May there be beauty above me. May there be beauty below me. May there be beauty in me. May there be beauty around me. I ask that this world be filled with peace, love, and beauty.
咁咧，啱啱咧就講咗一個詩去作為一個開始啦。咁呢首詩咧就係咁樣樣嘅。
為我哋創造萬物嘅力量，俾我哋嘅
力量嘅太陽。
太陽嘅祖父啦，月亮嘅祖母，地球母親啦，同埋俾我哋嘅祖先。我祈禱為咗我哋對自然嘅關係啦，我為所有可以行、可以爬、可以飛、可以游水嘅生物祈禱，可以為見到嘅、唔見到嘅，為到周嘅靈性啦。我要求我希望你可以為我哋嘅長輩、為我哋嘅孩子、為我哋嘅家族朋友去祝福，為咗我哋喺身在牢獄嘅兄弟姊妹，為咗我哋一啲被酒精或者係被染毒嘅朋友，為咗啲流離失所嘅人，我希望我為所有嘅人類祈求平安，願呢個世界有健康，有痊愈，願所有願美存在於我之上，願美存在於我之下，願美存在於我自己中裏邊，願美存在於我周圍。我希望我祈求呢個世界充滿住和平、愛同埋美。
I want to say just a couple of words about myself and Philip. We both of us trained at Lesley University in Boston 35 years ago.
我首先想介紹下我自己同埋我嘅丈夫啦，咁就我哋本身咧喺波士頓嗰度大學嗰度嘅。
I'm a professor at the university and director of international and collaborative programs, and Philip directs community and mental health centers that use the expressive arts. So we joke around. I train them, he hires them.
咁咧，我其實就喺大學嗰度嘅一位教授啦。咁我哋成日咁啊 Philip 咧就會去做一啲真係實質上做一啲服務去俾啲朋友嘅。咁所以我哋成日都講笑啦，就話我咧就係去俾呢個教嗰啲朋友，咁但係 Philip 咧就會去請佢哋去做嘢㗎啦。
I'd like to know just a little bit about who we have sitting in the room. So I'm going to ask you to raise your hands for me, and you can raise your hand more than one time. So anybody who's an artist or works with the arts in education or the arts in therapy, can you raise your hand?
咁我想了解下你哋啦。咁如果係做畫家嘅，或者做一啲表達性藝術嘅人嘅，咁請你舉手啊。
Anybody who works with health and with the body?
同埋身體嘅工作。
Anybody who's interested in the whole area of mind, body, and spirit? Raise your hands.
大家做全人類身體嘅工作嘅，對佢有興趣嘅。
We have a full house.
咁所以我哋咩人都有啊。
So let's get going.
OK，我哋而家開始啦。
Thank you to my nephew Mark for creating this slide.
非常多謝我侄仔佢就提供呢個文具嘅。
So today we're going to take you for a journey on how the arts are used in healthcare. We'll start with some definitions of health.
今日我哋就帶領大家喺呢個藝術同埋健康嘅旅程。咁首先咧就等我哋定義一下揾翻呢個健康嘅定義係乜嘢
And wellness.
安康嘅定義係啲咩咧？
We'll look at healing, the time-honored traditions of healing, which are so common and so integrated in Chinese culture and across the world.
我哋亦都會講下療愈嘅手法嘅。其實呢樣嘢喺中國嚟講已經講咗好耐㗎啦。咁當然啦，世界各地都會係有講翻治療或者係療愈嘅方面嘅事情嘅。
And when we begin to look at healthcare, caring, what that means.
講到健康照顧啦，咁其實關顧究竟係咩意思咧？
And then we'll look at 4 areas that the arts in healthcare are applied to. Patient care or individual patient care groups.
講到照顧嗰方面啦，我哋都要睇下究竟係個人嘅照顧啦、團體嘅照顧啦，定係病患者照顧咧？
The environment, and when you create art in a building, in a hospital, in a healthcare setting, how that itself can contribute towards healing and recovery.
我哋要睇下環境嘅，究竟喺藝術喺環境裏邊，譬如話我哋喺個環境裏邊喺個醫院裏邊擺藝術品嘅話，會產生到啲咩關係出嚟咧？
And how the environment itself can be both healing and a health hazard.
咁同埋我哋嘅環境咧，點可以亦都同時間幫到我咧，亦都可以係可能係一個危險嚟嘅。
The arts as they're applied to the community, how the community can actually heal an entire society.
亦都睇下藝術對於社區嚟講會可以有起到啲咩治療嘅效果。
And 4th, how the arts take care of ourselves as caregivers.
最後都係睇翻咧藝術點樣可以治療我哋本身嘅。
It's a lot of ground to cover. Those are 8 areas, so we'll just try to move through those and at various times give very specific examples and case studies also.
所以咧，我哋其實今日都會講好多嘢嘅，咁就有8個範疇啦。咁所以我哋會一一咁樣為大家介紹嘅。咁每一次介紹嘅時候，我哋都會有個具體嘅例子俾大家。
And time permitting, we probably will invite you to participate just a little.
如果時間可以嘅話，都邀請大家可以參與一下嘅，不過只不過係會有少少嘅試驗嘅啫。
You might remember Florence Nightingale. The Americans, we Americans certainly remember her. One of the first nurses. She really institutionalized the field of nursing.
咁不得不提咧，南丁格爾嘅，相信大家都好熟悉㗎啦。佢係美國第一位咧係成立一個護士嘅行業嘅，亦都係成立一個開創咗護理呢個範疇嘅。
And just a beautiful quote, already in 1859, realizing the importance and the healing qualities of the arts for individuals.
咁喺當時嘅早喺1859年咧，佢已經有一個非常好嘅講過一句非常之好嘅名言嘅。
Variety of form and color in objects presented to patients are actual means for recovery.
俾病人嘅睇嘅唔同嘅形狀或者唔同嘅顏色，已經係令到佢哋咧可以加速佢哋嘅治療㗎啦。
We already heard a definition of health. Thank you. Was it Rainbow, I believe, right? Thank you. That was already our first definition. But you begin to see when we talk about health, and specifically with the help of the arts, we are looking at wholeness.
咁好多謝頭先 Ringo 啦，佢係解釋咗咩叫健康嘅定義嘅。咁但係如果你睇下健康究竟係咩一回事嘅話咧，其實全人究竟係咩回事嘅話咧，其實個定義係好唔同嘅。
Wholeness. The original definition of wholeness was the original definition of healing was to make whole. Isn't that interesting? To make whole, to bring the various pieces together is a definition of healing.
咁如果我哋睇翻究竟全人嘅意思係啲咩咧？咁原來其實全人嘅意思你睇翻咧就係將所有將人嘅所有唔同嘅部分化零為整，咁就將佢變做一個歸一嘅一個實體嘅。咁其實呢個係一個好有趣嘅定義嚟嘅。
Very much a humanistic approach to work side by side with the medical community, not at all at odds, working together with the medical community.
其實就充滿咗人性嘅，就將藝術同醫療咧兩者結合一齊。
Combining physical, mental, and social well-being.
將人嘅身體啦、精神啦同埋靈性嘅健康咧都結合埋一齊。
Another beautiful definition of healing.
療愈嘅另外一個定義係咩咧？
And you look at definitions everywhere, and you begin to see the same words, the same concepts, bringing together the parts, bringing together the pieces, looking at suffering in terms of bringing breath and freshness into that.
And Dr. Rachel Raman has pioneered the use of storytelling as a healing form.
咁你如果睇翻唔同嘅同嘅療愈嘅定義咧，其實都係大家係萬變不離其中嘅，都係將所有嘅嘢化為一齊啦，化為一個完整嘅一體啦，同埋所以咧你可以見到咧，其實所有嘅定義都係差唔多嘅。
方式去。
So I was teaching a course last year, and one of my students wrote down something that I said, and then in her paper she quoted Dr. Spicer. I thought that was pretty nice. And I mean, I looked at the quote. At first I said, who said that? You know, that was a nice quote.
咁我上一年咧就教咗一個班嘅，咁當中有一個學生啦，咁佢喺最後一個功課裏邊咧就引述翻我嘅句子嘅，咁我睇到嘅時候我覺得開心啊！邊個寫到咁好嘅句子嘅咧
？So from birth, do you prefer that we read the slides out loud, or can you see that? Would you prefer that we read them a little bit also? Because sometimes we don't read the slides. Sometimes we just summarize. My wife, Vivian, is saying I should read the slides, and I like to not read them.
They should be read so they can also be translated for people who can't read them.
Okay, so we'll try to read most. Okay. From birth to death, we can see care as an opportunity for leading our society beyond pain and hardship and into a nurturing and collective caregiving society.
由生到死，其實我哋係由呢個關顧裏邊，我哋可以見到一個機會，係可以將我哋嘅社會帶我哋社會超越呢個痛苦同埋困難，去到一個非常之關顧，亦都係集體地非常之關愛嘅社區嚟嘅。
So this next quote is from Abraham Maslow, a very important psychologist that was the grandfather of the humanistic psychology movement.
咁呢句咧亦都係馬斯洛啦，佢係一個非常之重要嘅人性心理學嘅學者嚟嘅。
And this came out of the 1950s and 1960s again, as a complement to behavioral sciences, to behavioral therapy.
呢個咧亦都係對於喺裏邊咧，佢會讚行為健康，對於行為健康嘅讚譽嚟嘅。
And it's incredible today, regardless of what psychological orientation and even health orientations, how people have begun to understand the importance of relationship.
當中可以見到咧，無論你係心理學嘅邊個學派，或者係健康嘅邊一個學派，其實大家對於呢個關係、人際間嘅關係都係覺得係非常之重要嘅。
There is now emerging over the horizon a new conception of human sickness and of human health.
呢個而家喺我哋嘅發展嘅裏邊咧，我哋見到一個新嘅疾病同埋一個健康嘅定義。
Perhaps we shall soon be able to use as our guide and model the fully growing and self-fulfilling human being, the one in whom all his potentialities are coming to full development, the one whose inner nature expresses itself freely.
我哋見到一個新嘅模範，亦都係新嘅指引嘅。其實呢一個全人嘅定義係咩咧？就係一個內心裏邊係非常之能夠盡發揮潛能啦，亦都係可以發展佢所長嘅一個理想嘅人嘅圖像嚟嘅。
So we're going to stop for a moment here, and I'm going to ask you a couple of questions, which you're going to answer only for yourself. So if you're comfortable with closing your eyes, I invite you to sit comfortably in your chair. Find some way that you can get symmetrical, by which I mean left side and right side of the body do the same thing.
咁啊，邀請大家都眯埋眼啦，坐得舒服嘅，咁令到自己咧左邊同右邊咧都覺得好似好平衡咁樣樣。
Take a couple of minutes to breathe in and breathe out slowly.
想咧邀請你哋深呼吸，吸入同埋呼出。
And just for a moment, if you can, think about yourself sitting in this room, sitting in this chair, caring about your own body, mind, and spirit.
咁咧，你而家幻想下自己坐喺呢張凳，坐喺呢間房間裏面，諗翻自己身心靈嘅一啲健康嘅。
Think of what you do in your own life to balance your own body.
諗下你平時日常生活會做啲乜嘢去令到自己得到平衡？
Do you go for walks? Do you exercise? Do you swim?
你會唔會行、做運動、游水、
Do you dance?
跳舞、
Do body work?
做啲身體嘅活動？
Are you really taking care of yourself in the best possible way?
定係其實你都好少咁樣去照顧自己？
Is there anything else you could be doing as a daily practice to help keep yourself balanced in your own life?
有冇其他嘢其實你可以每天都做去令到自己得到平衡？
And just for a moment, if you can, think about all the people who are important in your life that give you support.
我哋亦都諗下，其實生命中有啲咩重要嘅人物去支持緊你。
Just for a moment, see if you can bring into your own present moment all of those people who all of your life have given you the help and the support and the friendship and the love and the companionship that have made you who you are.
我想你帶入腦袋，你所有你人生中幫過你嘅，同你做過朋友嘅，支持過你嘅，俾到溫暖你嘅朋友。
All of those people still living and those people who are no longer with us but remain in us.
無論佢哋而家仲在世嘅，還是已經係過咗身嘅。
And say thank you in your own way to all of these people who have contributed to who you are.
用你嘅方法去為佢哋講聲多謝，因為佢令到你做到今日嘅自己。
And then slowly, slowly, slowly,
然後慢慢
start coming back into the room,
我哋翻嚟呢間房間，
thinking about those people and those practices who keep you in balance.
諗翻起你一啲平時會做嘅嘢，或者你身邊嘅人，令到你有啲平衡。
Take one more minute to come back into the room.
我哋用多1分鐘時間，我哋慢慢翻返嚟。
Take a moment to come back in.
慢慢翻返嚟房間。
And when you are back,
當你翻到嚟之後，
if you're comfortable with doing this, why don't you turn to the person sitting next to you
如果你願意嘅，我哋都擰住面你身邊嘅朋友，
and let them know what you give thanks for.
讓佢哋知道你係想為乜嘢，你想講聲多謝嘅。
Okay, we're going to move along, but please be aware, within the sharing is a wealth of beautiful interventions and techniques and important ways of staying healthy.
我哋之後就會有好多唔同嘅活動啦，咁但係都希望大家可以理解或者知道咧，其實呢樣嘢係一個非常之對於健康嚟講係非常之好嘅自手法嚟嘅。
And like Dr. Rainbow Ho,
咁正如何博士啱啱講，
I'm a dance therapist.
我係一位舞蹈治療師。
I believe it all begins with the breath.
我相信所有嘢都由呼吸開始嘅。
And the best way that we can bring ourselves back to balance in any given moment
咁呢個最好嘅方法，令到我哋係得到平衡，每1秒鐘都得到平衡咧，
is just to remember to breathe.
就係去記住去呼吸。
So the next time you're having a difficult moment,
所以下一次你經歷緊一啲困難嘅時刻，
wherever that is,
無論你喺邊度，
promise me one thing.
都請你應承我，
When it feels really rough,
當真係好困難嗰陣，
you'll think of all of us
你會諗起我哋，
and all of the people who filled the room here as invisible ghosts of the people that care about you.
同埋所有你頭先喺腦袋幻想緊嘅一啲人物，係關心你嘅人，
And then you will remember to breathe.
咁你就會記得去呼吸㗎啦。
It almost sounds like we could end the lecture right here.
咁好似而家可以結束呢個講座㗎啦。
But it is that important. You know, it's amazing how we always come back to the breath when we work with and through the arts, in therapy, in education, in the arts and healing.
咁其實好神奇嘅，每當我哋利用藝術去做治療啊，去做教育嘅時候，我哋最終都會翻返去我哋自己呼吸裏邊嘅。
So back to the arts and healthcare.
咁我哋翻返下我哋今日嘅講座題目啦。
The creative arts are a time-honored form of holistic medicine.
咁我哋咧其實藝術咧就係一個關乎時間嘅一種全人類嘅健康嘅方法嘅。
They provide us with the ability to self-regulate and find our balance.
佢會幫到我哋去揾到平衡啦，同埋治愈。
They're endless sources of creativity.
佢哋係一個充滿住
Which includes problem solving,
咁就包括住去解決問題啦，
finding new ways of being that are good for me, for you, that are healthy for us.
揾一啲新嘅方法令到自己或者係令
and accessing spontaneity as a very important energy that stimulates the creativity, that moves us into creative spaces.
亦都令到自己保持即興，保持可以隨時可以進入到一個非常有創意嘅狀態裏邊嘅。
Which then includes flexibility. And we'll come back to flexibility later in the presentation when we talk about resilience.
當然啦，亦都係牽涉到我哋自己本身嘅靈活性嘅。咁我哋之後咧就會講翻嚟呢個概念裏面嘅。
The arts offer us a way of rejuvenating ourselves.
藝術咧係一個方法令到我哋年青啦。
When we get stuck,
當我哋塞住咗嗰陣，諗唔通嗰陣，
we found ways of transforming that stuckness.
我哋揾辦法去轉變呢一種塞住呢種感覺。
The arts are embedded in every ritualistic practice.
其實咧，藝術咧就喺所有傳統嘅儀式嗰度咧，都會裡面都有嘅。
And in ancient healing times, when we say ritual, once again, we go back to early forms and definitions.
當我哋預估嘅時候，我哋如果講係儀式嘅時候，我哋追溯翻以前嘅定義係點咧？
And throughout any culture, early forms of healing, ritual is a part.
追古索今喺所有嘅文化，因為以前嘅古文化裏邊，儀式其實係一種一個部分嚟嘅。
Why? Because ritual brings the individual into a community.
咁咧，因為儀式係令到每一個個人可以帶到佢哋去一個群體裏邊。
And ritual focuses energy and breath. Focuses like a laser beam to help the healing process.
而儀式咧，亦都協助到大家可以將所有嘅呼吸、所有嘅精力係集中喺一點裏邊。
And there are rituals that accompany individuals throughout the life cycle.
咁咧，其實我哋生命每一個階段咧，都會有唔同儀式嘅。
From the moment of birth,
由我哋出生嗰陣，
through all of the developmental stages,
由我哋唔同嘅長大嘅成長嘅階段，
there are rituals around puberty,
我哋會有儀式就係青春期嗰陣啦，
around coming of age,
我哋成年嗰陣啦，
and around all of the significant life passages.
咁同埋所有好有意義嘅人生嘅點滴時間。
And participation in ritual activities is intrinsically healing.
咁同埋咧，我哋參與傳統嘅活動嗰陣時咧，已經係好治愈㗎啦。
Definitions of expressive arts therapy.
咁呢個咧就係我哋表達性藝術嘅一啲定義嘅。
Expressive arts therapy interventions are always, no matter what the modality, body-based,
我哋無論係用咩方面嘅表達性藝術咧，其實都係由身體開始嘅，
they are developmental
係會成長嘅，
in the sense that they move individuals and groups from one stage to another.
即係話佢會由一個人或者一班人咧，由一個階段帶到去另外一個。
They tend to engage the whole person,
佢會係用晒你全人類嘅。
and these are approaches to health that address psychological, physical, and spiritual aspects of health and healing.
咁同埋咧，佢哋關乎於你心理啦、身體啦，同埋你嘅靈性嘅一啲健康嘅。
The expressive arts promote health and prevent illness.
咁表達性藝術治療咧，咁都會幫助我哋去健康啦，達到健康啦，同埋會防止病嘅。
They focus on the promotion of health through a natural holistic interface between physical, mental, social, and spiritual healing.
咁咧通過一個全人類嘅嘅一個媒介啦，就係我哋身體啦、心靈啦、社區啦，同埋靈性嘅療愈嘅方法。
And this is the really, truly important issue. They're not focused on illness or pathology.
最重要咧就係佢哋唔係咧針對性我哋有啲咩病啦，或者有啲咩問題嘅。
They focus towards health and healing.
我哋針對係健康同埋療愈嘅。
In the United States, there's a society that was formed for the arts in healthcare.
咁喺美國咧都會有一個會啦，就係關乎於我哋點樣去將藝術擺入我哋嘅健康裏面嘅。
They're a very significant force.
咁佢係一個好有好大力量嘅一個團體。
They include expressive arts therapists,
佢包括於一啲藝術性治療師，
complementary and alternative medical practitioners,
一啲我哋叫做另類療法嘅一啲治療師，
and most importantly, artists.
同埋一啲藝術家。
Arts and healthcare is a diverse, multidisciplinary field dedicated to humanizing the healthcare experience by connecting people with the power of the arts at key moments in their lives.
咁其實咧，佢係一個好人類嘅一個達到我哋健康嘅一個方法嘅，佢就會將我哋人啦同埋一啲藝術嘅力量咧，喺我哋重要嘅人生階段咧去擺埋一齊。
This, sorry. Oh, Philip says I said it already.
So, the benefits of arts in wellness and healthcare. There's a large body of research that is developing. It's not the scope of this lecture to go into that.
咁我哋講翻如果睇翻藝術對於健康有啲咩好嘅影響咧？咁其實已經有好大量嘅科學研究咧證明到藝術對於人類嘅健康係真係好，但係我哋今日咧就唔夠時間去逐一去介紹俾大家睇。
If you are interested, you can access the Society for Arts and Healthcare, SAH, Society for Arts and Healthcare, and they have amassed just about all of the recent research that is being done on their website.
咁如果你大家有興趣嘅話，大家可以登入Society of Arts and Healthcare 呢個協會嘅網頁裏邊嘅，咁裏邊咧就會見到好多研究嘅結果啊，俾大家睇到嘅。
Through all of the arts.
咁唔同種類嘅藝術都會有提到。
So you can see, just to summarize some of the benefits that research has begun to show, but that we know as common sense. We see, we observe, we know this.
咁從科學嘅角度去睇咧，大家可以逐漸都可以見到藝術咧對於健康嘅好處。咁其實，但係喺大家嘅常識裏邊都已經知道藝術其實對我哋大家健康非常之好嘅。
You start moving your shoulders, you start breathing into there, you start pushing and pulling. You're going to reduce some muscle tension. If
如果大家透過呼吸啊，透過伸展你嘅膊頭啊，其實已經大家可以感覺到情緒嘅分別㗎啦。
If you physically manipulate, we know will reduce tension.
咁其實大家已經有好多經驗，就係話透過你嘅身體嘅喐動，其實已經可以減低到你內心嘅壓力㗎啦。
If we visualize and draw, we know that the tension will begin to move.
如果大家將自己心裏嘅壓力去投射變咗一個影像，或者係透過圖畫去表達出嚟嘅話，其實已經係可以改變到呢個壓力嘅來源嘅啦。
As we learn to continue to increase our breathing without tightening,
咁透過我哋去觀察自己呼吸而唔令到佢哋去急促嘅話，
we see a better oxygen flow approaching. We see better circulation increasing.
大家已經覺得個氣已經係通咗好多㗎啦。
So, and then just to mention a few of the psychological benefits that we see. To be able to express one's feelings is an important component of health.
其實藝術睇下大家藝術對於生理方面其實都有好好影響嘅，包括係其實大家如果可以表達到自己嘅情緒，已經係一個對自己
The arts can actually help to manage and reduce anxiety and depression.
藝術可以減低我哋焦慮同埋抑鬱啦。
This is a 10-year-old girl in arts therapy, in music therapy, that I was working with for 3 months. So, 10-year-old girl afraid to go to school because she was just incredibly sad. I won't go into the full story. When I started working with her, she was able to go to school in the morning, so she had made a lot of progress. However, she was still crying at night with anxiety because she didn't want to go to school. She was afraid. And she managed to go to school, but every morning she's still crying when she wakes up. I don't want to go. I don't want to go. So in therapy, we're talking about the anxiety and the depression, yes? We're touching it, we're feeling it.
我曾經有俾一個為一個10歲嘅女仔咧提供一個音樂治療咁，之後女仔做咩事咧？原來佢係好唔中意翻學，好唔想翻學嘅。每一次喺朝頭早嘅時候咧，已經話要喊住咁樣話唔想翻學㗎啦。咁所以咧我透過如果係傳統嘅對話嘅治療嘅話，我哋會同佢哋講下有啲咩嘅焦慮嘅原因啊咁樣嘅。
So we labeled the anxiety that was bothering her, that was holding her back, causing tears. And we just started talking about, I would ask her, do you want this to be with you for the rest of your life? And she would say, no, of course, no. And what do you want to do with it? I want it to leave me alone, and that became a song, right? And then when she started the first week, it was like, leave me alone. I don't want you. And I would help create the song, right? Leave me alone. 我同佢傾過啦，究竟係啲咩令到佢好焦慮啦咁樣，咁我就將一個焦慮嘅來源咧就寫喺個 label 裏邊嘅，咁咧我就問佢你想點啊咁樣，我就想佢啲焦慮嘅來源咧幫我，咁所以咧我哋有一首歌叫幫我。So we begin to identify and label the feeling. It becomes something outside of us now. It's not just something I'm crying and, oh, thank you. This was improv. We didn't know we were going to do this. So we're labeling it. Oh, that's nice. After a few weeks, I'm pushing a little, going, do you really want it to be with you? No! Well, use your voice, right? And so you can help me sing it, okay? Leave me alone. Help me with alone, okay? I'll say, leave me alone. I don't want you. Leave me alone. I don't want. How would it be in Chinese? And just like we're doing, we could laugh. We did this song with many variations, for at least 5, 6, 7 weeks. I don't want to cry in the morning, I want to be with my friends, variations, right? And ooh, she got so loud at certain points, and she's pushing that anxiety and that depression away. It's not a cure. There's no magic. She needs to do the work, and she did. And then she practiced going, and it got easier. Her mother was so delighted. And after 6, 7 weeks, she understood the feeling better, and she could manage it better. And she stopped crying, and of course she started to go to school. Okay.
好簡單咁解釋翻啦。咁其實佢頭先講咧就係話，當你嘅焦慮寫咗出嚟嘅時候，其實佢將佢外在化咗嘅。而透過編曲啊，透過唱歌嘅話咧，亦都可以將呢個焦慮嘅情緒去越嚟越點樣外在化咗。咁佢中間咧就經歷咗5、6次嘅變奏嘅。咁啊，當講啊我想喊啊，想同朋友一齊啊咁樣。咁但係到最後咧，慢慢咧，逐漸嚟講咧，佢可以更加認識到自己嘅情緒係啲咩嚟嘅。咁所以到最後佢媽媽亦都好開心啦，因為所以佢哋可以重新可以返學啦。
Medication, when we need it, is fine as long as it's balanced very nicely with the mental component and the spiritual component and the health component.
其實如果透過藥物去控制情緒得唔得嘅咧，其實都可以嘅。最重要咧就係可以保持到平衡啦，亦都係可以同時照顧到佢哋嘅靈性啊，同埋心理嘅健康嘅。
What just happened when we all smiled and leave me alone? Did you notice what happened with the energy in the room? Right? Can you be tired and fatigued if your energy comes up like that? No. You slip back to being tired later, but for a short while, you're changing your emotional state, your quality state, in a quality way.
其實剛才大家一齊唱嘅時候，你係咪覺得自己裏邊嘅情緒啊，或者係裏邊嘅能量啊，係激發咗出嚟㗎？咁當然啦，到最後啊，你可能都會話就會攰啦。咁但係喺嗰個時刻嗰個情景裏邊咧，其實你自己你可以感覺到自己本身嘅能量咧係充滿住嘅。
So I want to move us along because we want to get to some case examples, but there are many benefits. These are just a few summarizing. PTSD is post-traumatic stress disorder.
我哋之後咧就會想盡量揸緊時間咧去睇下唔同嘅個案嘅。咁當然啦，藝術都可以治療創傷後嘅壓力綜合症嘅。
Managing anger and aggression, when we get ill, when we become very sick, a wide variety of feelings will happen to us as human beings. Not only depression, we take the energy inward at times, and we can take the energy outward into aggression.
其實對藝術對於暴力啊，或者係對於憤怒嚟講咧，都係一個好好嘅治愈嘅方法嚟嘅。咁有時候我哋將自己嘅能量放喺心裏邊，咁變成抑鬱啦。但係有時候我哋會將佢放之於外嘅，咁所以就會變成一個暴力嘅。
The arts allow us to touch it, to feel it, to move it, to play with it.
透過藝術啦，我哋可以將我哋嘅情緒去移動啦，去嘗試改變啦，嘗試去形象化佢嘅。
So we continue with the presentation, and now we move into the 4 basic areas that the arts are applied in healthcare. The patient, the individual care, those are the programs, the actual delivery of the arts to the individual and to the groups. In hospitals, in health settings, in any environment that has to do with health.
In the Behavioral Science Center here, in the university.
我哋可以睇下藝術喺人類安康裏邊啊，可以有邊幾個範疇咧？有4個範疇嘅。第一個範疇就係個人嘅或者係病患者嘅護理啦。第二個就係環境嘅，譬如話係醫院啦，或者係一啲嘅其他環境啦。當然包括係講病人中心啦。
Environments, community, and we as caregivers.
當然都包括社區同埋我哋自己作為一個治療者。自己都係一個有用嘅方法。
So, some benefits. So, patient individual care benefits patients by aiding their physical, mental, and emotional recovery.
第一個範疇係咩？就係個人或者係病人嘅護理啦。咁其實藝術有咩用咧？就可以幫助佢哋係加速身體啦、心靈啦同埋情緒上嘅復合嘅。
We reduce stress. We reduce loneliness from illness. We reduce loneliness and provide opportunities for self-expression.
我哋可以減低自己嘅壓力啦，亦都可以減低自己嘅孤獨感啦。亦都透過自我嘅表達自己嘅情緒，可以減低自己孤獨感嘅。
We don't have a lot of research studies, unfortunately, and not major with hundreds of thousands. But the research that we are starting to gather begins to show that there's a reduction in medication when you include the arts in treatment. 喺呢個藝術治療方面咧，雖然唔係有好多嘅研究可以做到出嚟啦，咁但係喺我哋自己本身做嘅研究裏邊，我哋發覺透過藝術治療嘅話，可以減低咗患者食藥嘅依賴藥物嘅程度啦。 And a reduction in the length of stay in hospitals. Now that's significant.
亦都可以減短咗佢哋住醫院嘅時間嘅，咁呢個係統計學上有顯著效果嘅。
And that shows the cost benefits, and that's what the professionals are looking for to manage hospital settings.
咁亦都代表咧非常有成本效益嘅，咁當然啦，呢樣嘢就係管理階層我覺得好睇重嘅一個因素。
But again, just to inform, these are beginning studies, they're not definitive, so we need to take that cautiously, but it makes sense.
當然呢啲只不過好初步嘅研究嚟嘅，咁但係咧初步結果我哋都覺得好鼓舞嘅。
And once again, the University of Hong Kong, I think, is one of the leading experts in the field in the beginning stages of doing this research. I take my hat off to you, Dr. Hall.
咁咧，佢都想鼓勵我哋佢都話我哋香港大學咧，其實都係為呢一種嘅研究咧做咗好多努力嘅。
So we want to do, we're going to move you in a moment to doing a little bit of work with playing around with some of these forms. And we want to talk about how you can use imagery.
咁咧，我哋一陣都會有機會俾你哋接觸下呢啲唔同嘅方法啦，同埋咧亦都用一啲幻想嘅方法。
And there are different kinds of imagery. There's guided imagery.
咁咧就有一啲透過佢帶領你嘅想像方法啦。
And there are various traditions who use different kinds of forms of this.
咁咧亦都即係以往都有好多唔同嘅唔同方法去利用呢樣嘢嘅。
There's kinesthetic imagery.
咁咧第一個就會係用身體嘅一啲想像方法啦。
And there's verbal imagery,
亦都有咧用講説話嘅方法。
which can include poetry, storytelling, drama, all of those forms.
咁咧就包括咧講故仔啊、唱詩啊等等嘅呢啲方法。
And using dance movement and expressive art therapies affects the body by working with negative emotions and fight-flight responses.
咁咧就要利用透過跳舞舞蹈藝術咧，就可以幫助我哋嗰啲負面嘅情緒啦。
There are researchers who are looking at measuring cortisol levels here at the university.
咁咧有好多研究咧，就睇我哋皮質醇嘅高低水平啦，
And how that affects illness.
同埋點樣佢會令到我哋嘅病健康嘅。
And how working with the positive emotions
咁咧透過利用我哋嘅正面嘅思想咧，同埋感受咧，
also begins to affect physical health.
同埋都可以影響到我哋嘅身體健康。
Because stress is mediated by perception of events and role of beliefs.
因為咧，我哋其實咧嘅壓力咧，都會係睇下我哋點樣去睇一啲狀況嘅。
And meditation are practices that train attention and awareness.
咁冥想咧係一個方法咧，係令到我哋訓練我哋嘅一啲專注力嘅同埋自覺能力嘅。
And the certain basic assumptions now are that our usual ways of functioning are suboptimal.
咁咧，其實我哋相信，其實我哋平時做，即係我哋平時生存嘅一啲方法咧，係唔係達到最高效益嘅？
That we can change that by developing higher states of attention and awareness.
咁咧，當我哋可以能夠更加專注、更加留意我哋身體咧，我哋可以改變呢啲嘢。
We can use it for ourselves and we can use it for our work with others.
我哋可以幫自己啦，亦都可以我哋呢個方法去幫其他人。
And this increases immune functioning and it decreases anxiety and depression and increases positive qualities.
咁咧會令到我哋咧係減低我哋嘅壓力情緒啦，令到我哋咧好嘅嘢咧就發揮出嚟。
And that's all leading me into talking about one of our research studies on focusing and art therapy with breast cancer patients.
咁咧呢個我就會而家開始講下，我哋有一個研究就係講專注力同埋藝術治療係俾一啲患乳癌嘅病患者。
And this is a research project that a group of faculty from Wellnes University conducted.
咁咧呢一個研究咧就係
where we used focusing and art, music, dance, drama therapy.
我哋咧就係利用一啲專注力啦，同埋一啲藝術嘅治療，包括音樂啊同埋舞蹈治療。
In a study which I'll present in a moment.
咁咧就係做呢一個研究嘅。
But first, Philip is going to lead us through what we actually used in the study, which is a piece of focusing technique, which we will teach you, which is called clearing a space.
咁咧，而家 Philip 就會帶我哋去嘗試下一個方法，係一個專注嘅方法。咁我哋喺呢一個研究係有用到嘅，就係叫做去清咗呢一個空間。
So focusing was a form of self-help that was developed by Eugene Gendlin in the 1950s and 1960s.
其實專注力嘅訓練咧，其實係一種自我治療嘅方法嚟㗎。呢、個方法咧，其實喺Eugene喺1950年或者60年代嗰度發展出嚟嘅。
And I'm not sure if it's translated into Chinese yet, but it's a very small little book, very easy to get hold of, called Focusing.
我唔知道有冇而家有冇中譯版啦，咁但係咧當時係出咗一本比較薄嘅一本書叫做 Focusing 嘅。
And we're going to do just the very beginning, and it takes a little time to work individually, so to do in a large group is a nice challenge.
咁我哋而家可以示範一下，咁但係咧個人嚟講其實比較困難嘅，咁當然啦，我哋一齊嚟做咧話，今次係一個新嘅挑戰嚟嘅。
However, the foundation of focusing is a very respectful approach to oneself and one body.
其實專注力咧，其實係對自己一份非常有尊敬心去對待自己嘅一個活動嚟嘅。
So if you can say to yourself, it's okay to just sit, nothing special has to happen, no expectation on myself, I'm just allowing myself to be here for 5 minutes.
所以大家如果可以容許到自己可以乜嘢都唔做，淨係可以喺度靜坐咁5分鐘嘅話，其實一個對自己一個非常之好嘅尊重嚟嘅。
And if you notice your mind saying something should happen, or right, or just see if you can put those feelings to the side and be accepting of yourself. It's a little like meditation, but it's not meditation.
其實呢樣嘢同冥想係非常之相近，但係其實唔係同一樣嘢嚟嘅。咁大家可以試下，當有雜念浮起嘅時候，可以將佢擺埋一邊，盡量咁知道自己係有呢啲雜念，但係將佢擺埋一邊。
So we use this form as a way of working with breath.
所以我哋通過呢個技巧，我哋可以為自己去訓練一啲呼吸嘅方法。
As a way of quieting all of the demands, I must be better, oh poor me, I'm so itched. So many different words. We use it as a way of quieting that, not to say don't have it, to quiet it, to put it to the side.
咁我哋透過呢個方法嘅話，可以令到自己心裏邊其實有好多念頭，譬如話我哋要做得更好啊，或者我做得唔夠好啊，呢啲聲音其實我哋唔係將佢完全係靜止咗，咁但係我哋會將佢咧個聲音係較少啲，咁就令到自己咧係比較安靜嘅。
To accept those words, but to understand that I also in my body can find a still place.
咁雖然自己有好多對自己嘅要求咯，咁但係我仍然都係有能力去揾到一個安靜嘅空間。
And with focusing, the idea that Gendlin developed was, if I can create a space for the stillness.
咁呢個活動嘅宗旨就係話，如果我哋有能力可以創造一個俾自己安靜嘅空間。
Then our body finds natural ways to deal with all of the pain, suffering, words.
咁自然我哋嘅身體就可以揾到一個方法去應付我哋身體嘅苦痛啊，或者身體嘅煩惱嘅。
So it's a little bit similar to meditation, but it's not meditation, and it's a very active way of sitting with oneself.
所以其實呢樣嘢係同冥想係非常之相似，但係其實唔係一樣嘢嚟嘅。咁其實係呢個係。透過呢個活動，我哋好主動咁樣揾一個方法，尋找一個方法去自我療愈。
And we'll now do just the first step, which is called clearing a space, being kind to myself, clearing a space.
咁我哋今次咧就示範下做第一步嘅。第一步咧就係對自己好一啲，對自己俾自己一個空間。我哋呢個活動咧就係話消除一個俾自己一個空間嘅。
And if we were doing a workshop, later in the slide presentation, you'll see how images and drawing and movement comes out of clearing, when you teach, clearing a space, then you can move further through the arts.
咁我哋之後嘅工作坊裏面都會用到嘅。咁當大家可以揾到一個安靜或者清除到一個比較空白空間嘅話，大家自然會有一啲可以透過意念啊，或者係透過繪畫咧，可以表達到自己嘅情緒嘅。
So, just take a breath gently, gently. We'll invite you now to sit for a few minutes without tremendous expectation on yourself.
咁我哋而家就算用呢幾分鐘嘅時間去令到自己安靜，係坐好俾自己但就唔好俾自己有太多嘅期望。
If you're comfortable closing your eyes, you can close your eyes. Sometimes you could keep your eyes open halfway and look towards the ground. That helps to stay focused.
所以大家可以，如果你中意嘅話，可以將自己嘅眼睛合上。但係如果另外嘅話，你都可以半開合低地咁望喺地下。
And just take a moment to scan through your body and just say, how am I? How am I? Don't answer in a normal way. Just let the question be. How am I? How am I?
大家可以用呢個時間可以問下自己，我自己狀態咩咧？咁樣大家可以唔需要有答案嘅，只需要問下自己，其實我自己而家嘅狀態係乜嘢咧？
So if you find yourself thinking, gently put the thought to the side.
如果發覺大家自己而家有個雜念喺度嘅話，你可以好温柔咁輕輕咁樣將呢個雜念放喺一旁。
And come back to the question in your body. Just allow yourself to be with your question in your body. No answers, just observe what's there.
讓我而家嘅狀態係點？呢個問題停留喺自己身體裏邊，唔需要有即時嘅答案嘅，只需要讓呢個問題停留喺身體裏邊。
How am I in this moment?
而家身體嘅狀態係點啊？
Just be with your body and your breath.
只需要同你自己嘅身體同埋呼吸存在。
How am I? If when thoughts come, just put them gently to the side.
如果你已經有雜念嘅話，你好温柔咁樣將佢放喺一旁。
You can always come back to things that are urgent and things that are pressing.
有冇啲好緊要嘅嘢可以遲啲可以處理？
So we're clearing a space in your body. It's almost like a starting point.
咁其實我哋而家係為身體留有一個非常安全嘅空間。
And a lot of times if we just stay with the question in our body will bring words and images that come fresh.
其實有時只需要透過呢個問題，問自己狀態係點樣，我哋嘅身體會自然咁樣話俾你聽，我嘅答案或者有好多不同嘅意念會出現喺你嘅身體上面。
So put things off to the side.
將所有嘅雜念放喺一旁。
And you came to this lecture, there's so many words, there's so many thoughts, there's so many situations. Put all of that to the side. Put it gently somewhere away from you.
大家嚟到呢個工作坊，當然帶住好多唔同嘅意念、唔同嘅想法，但係喺呢個時候，請大家將呢啲想法、啲意念放喺你嘅一旁。
And come back to yourself and the same question, how am I feeling right now?
而回歸翻我哋身體裏邊，問翻我哋自己嘅狀態係點樣咧？
And just allow words and images to freely float by.
讓自己腦裏邊嘅意念或者係圖像咁樣流過。
How am I feeling right now? Don't think about it, just let your body be.
而家身體嘅感覺係點樣啊？唔需要思考嘅，讓你哋嘅身體自在咁樣存在就得㗎啦。
And pay attention in your body, somewhere between your shoulders and your torso, somewhere in that chest area.
咁留意自己身體，特別係肩膀嘅兩個肩膀嘅中間，你嘅胸口，你嘅上半身。
And see if you could locate, where am I feeling the most right now? Where do I experience and feel my feeling right now?
大家可以揾下，嘗試去揾下身體而家你身體裏邊有邊一個部位係感受最多嘅咧？
And just let that be, pay attention.
就讓呢個部位安然咁樣存在，而自己將自己注意力放喺呢個部位身上。
Put it to the side. Putting a feeling, putting an image to the side is an exercise. Sometimes we can have a strong feeling come up, and this is just clearing a space. So if you need to put that feeling on an elevator or in a balloon, or create an image for you, put it somewhere on a bench, a little further from your source. You can always come back, it's not running, it's just allowing yourself some space.
將自己嘅感覺或者係自己嘅意念放喺一旁，其實係一個非常好嘅練習嚟嘅。好多時候我哋會嘗試將你嘅意念或者感覺放喺一張長凳上面，放喺一個升降機上面，放喺一個氣球上面，等佢自然而然咁樣離開一個，讓你自己離開呢個感覺。
We've been sitting for about 5-6 minutes, so just shake out, don't lose your focus, but shake out your shoulders a little. We're going to end in 2 minutes.
我哋而家大概已經經過咗5分鐘㗎啦，咁就但係唔好喪失大家嘅自己注意力，你可以輕咁樣喐自己嘅膊。
Take a breath, make sure you're awake. This is a very active sitting. It's okay, yeah.
大家可以深呼吸一下，盡量唔俾自己入睡。其實呢個係一個非常之積極嘅一個運動嚟嘅。
And ask that space in your body where you feel things the most.
咁講一下身體裏邊而家感受最多嘅一個空間。
What? And in a way that you don't have to answer. Just leave the question in your body.
其實大家唔需要回答嘅，只需要將呢個問題放喺你身體裏邊。
What is most important for me?
有啲咩對我嚟講係最重要㗎？
What is my most pressing thing right now, just for me?
而家對自己最感觸嘅嘢係啲咩咧？
Just let your body be with the question with respect.
大家尊重自己，可以嘗試尊重自己嘅身體，讓身體回答你呢個問題。
Observe if words or feelings come up and place them to the side.
去觀察，去留意，然後將佢放喺一旁。
Just let the question be with yourself.
嚟讓呢個問題留喺自己身體上面。
Just clearing the space, knowing that you can always come back, an issue, a pressing concern, problem, it doesn't leave us. It's always with us, but we can create a space before we go into dealing with it.
讓自己開拓一個安靜嘅空間，我哋唔係將呢啲令我哋焦慮嘅嘢放棄，而係只係將佢放喺一旁，我哋只可以將佢自己處理。但係喺而家呢個時候，我哋留俾自己一個空間。
And slowly bring your attention back to the room. Open, I see eyes open. Come on back.
而家可以打開自己眼睛，將注意力留翻喺呢個頭殼裏邊。
First, say thank you to yourself for just allowing yourself to sit for 7 minutes in quiet.
首先要多謝自己，多謝自己可以容許自己坐喺呢個房間裏邊安靜咁樣度過一7分鐘。
So before we go forward, please, sometimes sitting like this can be very personal. We come into very personal thought or space. And we'd like you to share for a few minutes with others, but just, you don't have to share a personal story. You can find a way that's comfortable for you to say a few words to your neighbor. Something happened, maybe nothing happened, but share where did you go in the sitting. A few minutes, just a few minutes on what happened to you when you sat. Were you able to clear a space? Did your mind start thinking so much? Okay? But be protective of yourself and how you share things.
喺上呢個幾分鐘嘅時間，可以同你哋坐喺隔離嘅朋友交換下剛才嘅經驗，唔需要好個人，你可以學識用自己最舒服嘅方法分享翻頭先嘅經驗，可能係有機會揾另外一啲都好。
3 minutes to talk. Okay. Say thank you to your partner.
咁樣同你身邊嘅人講聲多謝。
And due to time, we're going to move forward. We're not going to take feedback at this point, okay?
咁因為我哋時間關係咧，我哋都會繼續講㗎啦。
We want to give you just a couple of concrete examples of some of the arts and healthcare work that we've done. So I'm going to describe the study that we did using focusing and the expressive therapies with women with breast cancer.
咁咧，我哋都想俾翻你哋一啲實際嘅我哋嘅經驗啦。咁首先我都會想講翻我哋嗰個專注同埋藝術性治療為咗嗰啲乳癌病人嘅呢個研究嘅。
We had intensive weekends, so we had the women in this beautiful outdoor natural setting in a breast cancer retreat center.
咁我哋咧就喺一個好寧靜嘅地方咧，就度過咗一個星期6日嘅。
We had groups of 8 to 10 women.
我哋咧有一組嘅8至10個嘅乳癌病患者啦。
Inside and outside spaces to work in.
同埋一啲室內同埋室外嘅地方去做工作嘅。
We worked with the visual arts.
我哋利用咗係視覺藝術。
And here are some of the drawings that the women made about their illness.
咁呢啲咧就係一啲我哋啲朋友畫嘅一啲圖畫，關於佢哋嘅病。
This drawing says, "I want to pull you close to suffer as I do."
咁咧呢一幅畫咧就講我想拉你去同我一樣去經歷咁多嘅痛苦。
I want to hold on to my heart. I want to free and fly close to the sun and near to the moon.
我咧想帶住我自己嘅心，然後去飛上去個太陽同埋月亮嘅。
And what we found in the study is that we used the protocol of focusing and clearing a space. So before we began the research study, we distributed a series of qualitative questionnaires. And we used the Grindler experiencing scale, which is a scale that's used to measure focusing. And we administered all of these scales prior to the retreat, and then after the retreat, and then a month after the retreat. Our sample sizes were small, and even though they were small, we found that there was statistical significance, particularly in the area of the Grindler scale, which measures focusing. So we're now going to have a wider sample. The next time we do the study, we'll have more participants in it, so that we can establish the kind of statistical significance that we need in order that we can prove that the arts are helpful on a wider scale.
咁咧，其實我哋喺呢一個研究嗰陣，我哋即係做呢個治療之前啦，之後咧同埋1個月咧都俾咗一系列嘅問卷啊啲朋友去填嘅。咁其中一個咧就係關於專注嘅一個問卷咧，其實我哋發覺咧，雖然我哋係唔多人去做呢個研究，但係都發覺有一個即係顯著嘅效果嘅喺我哋嘅度完之後，咁我哋咧將來咧就希望可以有一個多啲嘅人去參與呢個研究啦，咁我哋可以即係令到我哋啲效果更加顯著嘅。
And now we're going to continue to move into the other areas that the arts are applied to in healthcare.
我哋而家可以睇下藝術喺其他嘅範疇應用。
And this second area is changing and transforming the environment itself in health settings.
我哋透過藝術去改變我哋身邊嘅環境，特別係喺醫療方面嘅環境。
So there's 3 areas. You create functional environments, so the entire environment becomes living and breathing with arts.
透過藝術，其實我哋可以將呢個好多唔同嘅醫療設施嘅功能係發揮嘅。
We have lots of examples of the architecture itself transforming the walls, the floors, so that they're just more inviting.
亦都透過不同嘅建築元素啦，譬如話喺牆上面嘅裝飾啊，或者係透過燈光咧，可以令到啲人喺裏邊咧係更加舒服。
And research is beginning to show that the physical environment can aid. If you transform that physical environment through the arts, it can aid in reducing stress for patients and the caregivers and improve health outcomes.
而家我哋有啲研究亦都發現啦，原來透過藝術去改變我哋周遭嘅環境，其實可以幫助到患者去減低佢哋嘅壓力，亦都係可以增進佢哋嘅治癒嘅速度。
These are just a few examples. These images were pulled from Google Images. A hospital garden in Paris.
大家去睇下喺熒幕上面嗰啲圖畫啦，呢啲圖畫其實都係喺互聯網裏面download落嚟嘅。咁其中一個咧就喺法國裏面嘅一個醫院嘅迷宮啦。
The middle space is just the images that you see, but this is one of the largest performance and arts projects in all of England. And they do festivals, they invite the community into the hospital. It's a huge annual project that goes on.
而中央個通常咧就係喺英國倫敦裏邊咧係每年一度嘅一個大嘅盛事嚟嘅，就係透過呢個裝置藝術同埋一個表演藝術咧係將呢個藝術嘅元素咧帶去醫院裏邊嘅。
And the third is the Pain Fest that takes place over in the Chelsea Westminster Hospital.
呢個咧就係而最右手邊嗰幅咧就係透過繪畫啦，透過喺牆上面圖畫咧係達至呢個藝術治療嘅。
And this second example of environments is a school that I've worked at for the past 15 years.
而家啲你可以見到嘅圖咧就係喺裏邊係做咗15年嘅一間學校嚟嘅。
It's called the Carter School in Boston, Massachusetts.
呢個就係馬克思主州嘅波士頓市裏邊嘅一個 名為 Charter School 嘅一個學校嚟嘅。
And each year I bring in a team of arts therapists to do music, dance, and art therapy.
每一年咧，我都帶好多唔同嘅藝術治療師啦，包括係舞蹈治療師、藝術治療師咧，去做喺裏邊咧進行治療嘅。
Children with the most severe medical disabilities. Most children are in wheelchairs. None of the children at the school can speak any verbal language.
喺裏邊喺呢間學校裏邊嘅小朋友咧，全部都係身患重疾嘅，有每一個人咧其實可以用口講到佢哋嘅説話嘅。
And what we did together with the school was create a sensory garden.
而我哋喺呢個學校裏邊咧，就做咗一個叫做觸覺嘅花園。
Cost approximately $1 million to build.
花費咧就達到100萬美金嘅。
It is a state-of-the-art, most beautiful, what we call it's a outdoor learning classroom.
呢個就係我哋稱為呢個戶外嘅學習嘅課室嚟嘅。
And so the children can touch, feel, and breathe the art of the beauty of smell, tactile and touch.
咁啲小朋友咧可以透過觸覺啦、聽覺同埋味覺嗅覺咧可以感受到呢個藝術嘅。
And in the summer, in spring, and fall, my staff work with the students in the garden, transforming the garden into an art space.
而每一年嘅夏季同埋春季咧，我同我嘅同事咧都會嚟到呢個花園裏邊啦，將呢個花園咧改造成一種藝術嘅空間。
In the interest of time, we're going to go through some quick examples of community well-being programs and projects.
And often the community work that we've done includes the direct individual and group patient work, including the larger community perspective.
而我哋做嘅好多嘅社區嘅項目咧，其實都係同呢個病患者係將病患者同埋社區咧係連埋一齊嘅。
In Swaziland, in Africa, there is very high prevalence of AIDS. And significant arts-related projects to help deal with the problem of AIDS. And one of the most impressive public art projects is the AIDS Memorial Quilt. This is the last time it was laid out in its entirety in Washington. It's way too big now.
And you might remember when AIDS started in the 80s, no one was allowed to talk about it. Everyone had guilt. Anyone who was afflicted was left with guilt. Parents and loved ones had no way of expressing their care towards the people who had died.
大家可以記得翻80年代嗰陣時候，愛滋病啱出現嘅時候，大家係唔敢講、唔敢提及關於愛滋病嘅嘢，而家屬咧都唔可以咧表達到自己嘅情緒嘅。
So what started as grassroots way of memorializing those that were lost turned into a social movement to help bring about resources to fight AIDS.
而呢個 Memory Quilt 呢個活動咧，佢最初係大家只係集埋一齊去紀念我哋失去咗愛滋病嘅朋友嘅活動嚟嘅，咁但係慢慢咧變成一個社會嘅活動，去對抗愛滋病嘅。
And I'm not going to get into the definitions of trauma, but I'll describe quickly some projects that we did. This is a project we did following September 11th in the United States. These are grassroots artistic expressions. And some memorials that were created. These are living tree workshops that we did probably several hundred of in various areas throughout the United States and across the world,
to allow groups in the communities to come together and discuss and express how they felt after 9/11.
咁咧呢一個 Living Tree Workshop 咧，咁係讓我哋即係社區唔同嘅人，就算美國啊或者其他地方嘅人咧，去表達翻對呢件事嘅一啲感受。
and a museum show that we curated on the May following September 11th with artistic expressions around it.
咁咧一啲藝術展覽啦，咁我哋都係關於呢啲事件。
And the third project after the art exhibition, the New York City Department of Youth, working with us in Boston to create programs for thousands of children that would teach resilience. How do we overcome hardship through building strength, creativity, and resilience?
研究咗之後咧，我哋同市裏邊嘅小朋友啦，亦都提供咗好多嘅活動嘅，去提升佢哋抗逆能力嘅。
And this is a project that we did 2 years ago with 100 volunteer arts therapists working on the issue of violence in the community. And what we did was we brought together 100 volunteers, trained them with 50 students, teenagers, and we went into programs for the elderly, all on 1.5 days. And we asked the elderly, what is your message to combat violence and promote health?
This is the Natal Center. Sorry.
呢個就係我哋2年之前嘅一個活動嚟嘅，咁就係透過100個義工啦，同埋藝術治療師咧，去對抗呢個社區裏邊嘅暴力嘅。
This is a center in Israel called Natal. It was founded by Judith Rekonati, a Leicester University graduate. It works with soldiers returning from war, and it's an arts-based intervention.
咁咧呢一個係一個喺以色列嘅一個地方啦，叫 Natal Center 嘅，咁就係幫助一啲打完仗翻嚟嘅啲士兵。
These are programs that came out of your university, and Dr. Rainbow Ho and Deborah Kalmanovitz went into Sichuan in China after the earthquakes and did a program there.
咁呢個項目咧就係我哋中心何天同博士啦，同埋其他藝術治療師咧做嘅，就係四川大地震之後咧就入咗去一啲學校，幫啲老師去做。
Assisting to prevent trauma and to help those that were traumatized.
去幫助一啲防止佢哋之後，即係經歷過一啲創傷之後嘅人啦，同埋防止佢哋咧去繼續受到創傷。
And another program promoting community well-being that was created by Eveline Liang Kan.
咁另外一個就係 Adelina 央刊去做嘅一個社區項目啦，
Called Bandages for You.
就叫做分愛貼嘅。
And the last element of our presentation, caring for caregivers.
咁我哋最後都想講點樣去照顧一啲照顧者。
And that's the most important element, is how people who work in these fields and all of the fields that all of us in this room work in, how it is that we care for ourselves so that we don't have compassion fatigue, so that we prevent burnout in ourselves.
咁其實都係呢個係好重要嘅，因為我哋都要幫我哋自己喺度在座每一位啦。咁我哋都唔會因為咁樣而即係幫得太多人而覺得好攰。
And coming towards the end of our presentation, we'll have a few minutes for questions in a moment.
The arts and medicine, these are two human callings that belong together, and our challenge is to rediscover the ways in which they can most effectively be brought together again.
咁其實藝術同埋醫療咧，呢一兩個嘢咧，其實佢哋係息息相關嘅。咁其實我哋要做嘅嘢咧，就係點樣去將呢兩樣嘢擺埋一齊。
This is what we bring to each other. We bring hope.
咁呢個就係我哋帶俾大家嘅一樣嘢。
And we're going to leave some time for questions. I'll leave the bibliography up for you in case anyone's interested in the references.
咁呢度就有啲參考嘅資料可以俾大家啦。咁而家大家都可以隨便用。
Thank you all very much.
多謝大家。
好，咁啊，多謝兩位講者啦。咁我哋而家咧有啲時邀請在座嘅朋友，會唔會有啲問題想發問啦，或者聽咗呢個講座之後有一啲嘅感受、想法可以想分享咧？咁我哋都好歡迎各位可以試俾我哋知，咁我哋會交個咪俾嘅。
Yes. And we promise we'll get you out by 4:30.
I would like to go back to the definition of WHO is also about well-being, right? Despite the disease. All the action you show is after somebody have trouble, to make it short. So should it be also important to do a preventive art therapy to avoid to need a therapy? I guess the more important thing and the more trouble we have now is people are more and more disconnected with themselves, right? So should it be one main action to prevent everything after?
Absolutely, yes. I think that you've raised a very, very significant point, that all of the work in the arts is both preventative and healing. Thank you.
In the work with trauma around the world after the terrible earthquakes and after the terrible hurricanes, research shows that 20% of the children will acquire post-traumatic stress disorder. That's a lot of people that will become very, very ill psychologically. With arts-based interventions that are going on now, and there are large grants that are being performed, Robert and Dickie Macy, and here in Hong Kong with the work, I don't know the percentage that it brings it down, but significantly reduces that 20% to prevent trauma in children also. So, very important question.
And I'm like you. I think that the more that every one of us every day can find those practices which keep us in our balance, the more we'll prevent for ourselves future outcomes that could be more difficult to deal with. And we'll take this one as the last question so that everybody who needs to leave can leave, but we'll be here, so anybody who wants to stay and ask questions, we'll be around for a while.
I was just curious to get your opinion as to whether the community or the professionals or wellness aspects actually, how to put it, actually make more money from disease and cure, or do they make more money from prevention? Because I wonder, where is our resources going? Are we actually possibly having a vested interest in illness because people may be making more money from illness than prevention? I was curious, because I hear this every now and then from other people who are in the wellness field.
It's a great question for creative arts therapists because none of us make very much money. It's a great question. I think that people, nearly normal neurotics like me, for example, invest in the preventative aspects of it because we have that luxury. I wish that there was a way that what you say about illness could be translated into what is said about wellness. I think that hospital and immersive systems are much more likely to pay for services when people are actually ill. I think that it goes back to your original question as well. If we could put the money more in prevention and not only apportion the money in illness when we could be preventing the outcome of that illness in the first place. It's harder to get funding for prevention than it is for dealing with actual illness, unfortunately.
Last question. Okay, one more last question, then we'll have to.
Then we'll stay, and anybody who has more questions, we'll stay to answer anybody else's personal questions.
Okay.
好簡單，頭先嗰位先生問嘅問題就係話錢從何來咧？究竟係預防嗰方面係會有多嘅資源啦，或者係治療疾病嗰度多啲資源咧咁樣？咁回答就係話其實呢個係好好問題嚟嘅。咁好多時候我哋都係將資源投放喺治療疾病嗰度，其實預防嗰方面咧亦都係相當重要嘅。
One more gentleman there, and I think that'll be the last question.
The Chinese calligraphy and water ink painting is something very closely embedded in Chinese culture. I think from children to elderly in Hong Kong or most Asian or Chinese culture, they are really connected. I don't know, my question is, have you ever tried using, calligraphy or water ink painting in your expressive art therapy? And the other question is, question 1 sub A is, how do you conceive the kind of Chinese culture, like in the form of calligraphy and water ink painting, and its application in the expressive art therapy?
It's a lot. We haven't used Chinese forms of calligraphy, but I believe in our art form and movement will slow the process, so it'll have a similarity, but definitely not the discipline form. That's first.
Also, Dr. Grace Kwan, who's just graduated from Leicester University, used calligraphy, Chinese, she's from Hong Kong, and she used Chinese calligraphy in her study. And we have Korean students who've completed their dissertations where they've used calligraphy. So if you're interested, I can help find the references for you that might be useful. I think that the sense of beauty in Chinese culture is significant, and that the harmony that brings people is very, very important in this field as it develops here.
And you have so many beautiful forms to promote health, which are indigenous to the culture, and that's important to develop, and because everyone understands it. It's such a Tai Chi is such a beautiful, simple form that everyone accepts, and it is so health promoting. So I believe each culture needs to hold on to those forms, and then when you just allow yourself to breathe with it, slow it down, and look at ways of coming together as a community, it begins to be helpful. But I think we'll have to, there was a second part of the question which I'm not remembering now even, but I think we have to end here, so we'll end here.
So one simple gesture to close with, it's the same gesture we used in the workshop we did last week. Hands to heart. Hands to sky. Hands to sky. Hands towards each other. Hands towards each other. Hands to heart. Thank you all very much.
Thank you to our translator. You worked very hard.
同事幫我哋做呢個傳譯，咁更加要多謝就係各位嚟到今日我哋呢一個活動啦。短短2個小時嘅分享，希望大家都有一啲嘅啟發，關於一個全人嘅治療，或者原來除咗傳統醫療以外咧，仲有好多嘅方式、好多嘅媒介咧，我哋可以為我哋嘅身心靈嘅健康啦、平衡啦，都可以帶嚟好大嘅幫助嘅。咁喺大家離開之前咧，就有少少嘅簡介或者介紹需要大家留意一下嘅。咁大家入嚟剛才咧，應該喺你哋座位上面或者我哋同事有派發咗幾份資料嘅。第一份咧就係一個紫色嘅form 啦，咁係一個我哋嘅呢一個意見表。咁希望大家今日都可以俾翻啲意見我哋，關於我哋嘅 program 啦，關於我哋將來嘅活動計劃都好有幫助嘅。請大家可以如果可以嘅話咧，花少少時間幫我哋填寫咗呢份問卷。咁填好之後咧，就可以攞翻出去出面我哋嘅 reception counter 嗰度，咁可以放翻低就 OK 噶啦。 咁另外咧有一個就係關於我哋嘅整個活動，其實陸續仲有好多更新嘅資料嚟緊嘅。咁我要介紹下大家點樣用呢份單張。咁中英文齊備㗎啦。咁如果你有一啲本地嘅朋友啦、外國朋友啦，都可以將你單張嘅資料去宣傳俾佢哋啦。咁同埋咧，我哋都有一個係Facebook 嘅網頁，同埋有個我哋Centre。我哋中心嘅本身嘅網站亦都有相關嘅資料嘅，同埋有個如果大家有用智能手機咧，咁喺呢個單張右下角有個 QR code 㗎，咁攞個機出嚟咧，有翻嗰個 Apps 去撳一撳掣咧，就會帶到去呢個網頁啦，好方便。咁我哋嚟緊下一次嘅 program 咧，會係4月份嘅，咁有呢個 Quantum Touch 就係一個能量治療嘅一個介紹同埋一個培訓工作坊，咁中文名咧就係叫量子觸療，係一個比較新嘅一個能量療法嘅方式嚟嘅，咁所以如果大家有興趣咧，都可以密切留意。咁另外7月份我哋都有一個身心靈嘅工作坊啦。8月份咧有個資料大家見到係一個詳情容後公佈，其實好快會公佈啦，因為有一個好好嘅舞蹈治療師嘅課程咧，我哋都會帶入嚟呢個 program 入邊嘅。咁另外就11月係我哋重點嘅活動，因為我哋將會有一系列包括一啲嘅研討會啦，同埋一啲工作坊咧，會係11月比較重點年尾嘅時候嘅活動。咁去到年尾12月份咧就會有一個總結會，咁希望尤其是我哋特別鼓勵係行內嘅同工啦，各位都可以一齊參與，甚至會邀請埋你哋機構嘅同事一齊嚟去做一啲嘅分享或者俾啲意見，因為我哋整個計劃係真係希望推動譬如呢啲公開講座，我哋希望多啲朋友，就算非專業嘅朋友都可以有機會聽下呢啲主題，但係更重要，我哋希望咧喺嚟緊陸續呢啲活動推行嘅同時咧，可以將更加多呢啲元素引入去我哋嘅醫療系統裏面，讓更多嘅病人啦、家人啦等等可以受惠嘅。咁大家可以繼續留意我哋網站嘅資料，同埋2013仲有好多活動嚟緊嘅，咁繼續留意。咁最後咧就係有一張單張啦，咁咧終於係大家因為聽咗好多關於藝術治療，可能都好有興趣。咁有一本英文嘅書啦，咁係我哋其中一位同事阿 Jordan 啦，咁佢同埋另外啲同事一齊去籌備嘅一本關於 art therapy 嘅書，未面世嘅，咁但係即將會面世啦。咁大家可以留意一下呢個宣傳單張。如果有啲咩消息，我哋之後本書已經面世咗，亦都會喺網站嗰度亦都會有啲要同大家分享嘅，好嘛？咁多謝咁多位嚟，不如我哋大家俾啲掌聲自己。如果有少少嘅時間，一齊去聽就分享，好感恩大家喺度。咁希望4月份嘅時候再見大家。Facebook 除咗留意活動資料，如果你聽完今日嘅活動或者有啲感想咧，不妨留言啦。咁喺我哋嗰度，希望我哋個 Facebook 網頁係更加互動嘅，好嘛？多謝晒咁多位，唔該晒。
I think in 3